last 24 hours, we identified 770 new cases of COVID-19 and completed about 11,800 tests. Our positivity rate was about 6.5%. There are currently active alerts or outbreaks in 288 schools. Of these, 4 schools had 10 or more COVID cases who attended in the last 14 days while infectious. There are currently 912 people being treated for COVID-19 in hospital, including 201 in the ICU. We continue to see these numbers declining, but it's important to remember that this takes time, and this trend could reverse quickly if we are not careful. Sadly, over the last 24 hours, 8 new deaths were reported to Alberta Health. I want to send my condolences to everyone grieving the loss of these Albertans and to anyone who's grieving loved ones lost to any cause. I know their passing leaves a hole in their families and their communities. We continue to see that the majority of Albertans ending up in hospital, requiring care in the ICU, or dying from COVID-19 are unvaccinated. That is why we continue to urge every eligible person in the province, anyone 12 years of age or older, to get fully vaccinated as soon as possible. I'm afraid I don't know the number of children 5 to 11 in Alberta off the top of my head, but of course that particular age group is one that we have been looking forward to having the opportunity to have vaccine available for. We know that Health Canada received the data from Pfizer around the safety and efficacy of the vaccine for children in that age group just this week. And so it is absolutely critical that they take the time they need to assess that data and follow the steps that they take when assessing new vaccines. We know that this particular formulation is a little different than the one used for adults in terms of having a slightly lower dose. And we want to make sure that we're waiting for that review that Health Canada does before making that vaccine available to children. Of course, it's going to be important to be able to offer that, again, not just for children, particularly those who may have health conditions that may make them slightly higher risk than others, but also because we know that, especially with the Delta variant, that children can transmit more readily to others. So it will be important to have that option. But again, the number one concern at this particular moment in time that I have is to make sure that Health Canada, as of course they are doing, as they always do, takes the time that they need to make sure that the vaccines pass all of the tests that all vaccines pass, so we can confidently offer it to children in Alberta. I'm asking Albertans as clearly and strongly as possible to please be wise and safe while celebrating this year. We have posted tips and advice online to keep our Halloween fun on the safe side. I'd encourage everyone who is planning activities to review this information. There are a few key pointers that I'd like to flag right now. First, and this is most important, if you are sick with even mild symptoms, please stay home and don't hand out candy. Second, this is not the year for large Halloween parties. If you're planning a Halloween gathering, try to have it outdoors and make sure that the limit of no more than 20 people is observed, with 2 meters of distancing between members of different households. For indoor Halloween gatherings, the current public health restrictions strictly limit social gatherings in private residences to no more than 10 people from 2 households for those who are fully immunized. For eligible adults who are not fully immunized, indoor private social gatherings are not permitted. If you're going trick-or-treating, be sure to wear a non-medical mask and go only with your own household members. Sanitize your hands often, especially before eating treats, and keep your distance from others. If you're handing out treats, you should also wear a mask and try to limit contact with others. This could mean using tongs to hand out prepackaged treats or setting them out on a blanket or tray for contactless pickup. If you are setting out treats, avoid using a bowl, but please keep those treats spaced apart. Last year, we saw many generous Albertans get innovative when finding ways to safely deliver candy, and I heard from many Albertans who enjoyed the day. We can have fun with it again this year, with creative ways to celebrate the occasion. While our numbers have been falling over the last few weeks, with rising vaccination rates combined with our public health measures to reduce transmission, we still have a long way to go. Last Halloween, we had about 5,600 active cases. Right now, we have almost double that amount. Last Halloween, there were 141 COVID patients in hospital. Right now, there are over 900. This Halloween, we can still have fun, but please do it in a safe way.